Most men over 60 live with a silent, growing discomfort that they mistakenly believe is just a normal part of aging. Every night, the frequent trips to the bathroom are not merely an inconvenience. They are a signal from your body that requires your immediate attention. Many believe that the aging prostate is a ticking time bomb, but the truth is far more manageable if you understand the biology behind it. The prostate is a small gland, roughly the size of a walnut, located just below the bladder. It plays a critical role in the male reproductive system. Yet as we cross the threshold into our 60s, this vital organ often undergoes changes that impact our daily quality of life. The biggest mistake men make is waiting for pain to manifest before seeking information. By the time physical pain or severe obstruction occurs, you have already missed the most critical window for proactive management. This documentary will break down the complex mechanics of prostate health into clear, actionable knowledge. We are going to explore why your body behaves this way, what the medical consensus is, and how small, daily adjustments can preserve your health for years to come. The goal is not to alarm you, but to empower you with the facts. Many seniors view the prostate as a mystery, a complex organ they have little control over. However, science tells a different story. Understanding how this gland functions is the first step toward reclaiming your nights and your confidence. Let us look closer at why this specific part of the body begins to change as we age. To understand the prostate, we must first look at its position. It surrounds the urethra, the tube that carries urine from your bladder out of the body. When the prostate enlarges, a condition known medically as benign prostatic hyperplasia, or BPH, it begins to squeeze the urethra, much like stepping on a garden hose. This is why the primary symptoms involve changes in urination. You might notice a weak stream, a sense that the bladder is never quite empty, or the sudden, urgent need to go. These are not signs of just getting old. These are mechanical symptoms of a physical obstruction. It is important to note that BPH is not cancer. It is a non-cancerous growth of the prostate gland. But because it is so common, many men ignore the symptoms, hoping they will just go away. The surprising reality is that by age 60, more than half of all men will experience some degree of BPH. By age 80, that number climbs to nearly 90%. When you ignore these symptoms, you are not just dealing with sleep deprivation. You're putting unnecessary stress on your bladder and kidneys. The bladder must work harder to push urine past the narrowed urethra, eventually leading to muscle fatigue in the bladder wall. This is why addressing the issue early is a cornerstone of long-term health. We will now examine the subtle daily habits that can either accelerate or alleviate these symptoms. Many men notice the signs gradually, which makes it easy to normalize the discomfort. You might start drinking less water before bed, thinking it will stop the nighttime trips to the restroom. While this seems logical, it is often a mistake. Dehydration can lead to more concentrated urine, which actually irritates the bladder lining and increases the urgency to urinate. This is a classic example of how well-meaning habits can backfire. Another common sign is the hesitancy, standing at the toilet for a few seconds before the flow actually begins. Or perhaps you feel like you need to go again just minutes after finishing. These are clear indicators that your bladder is struggling to empty completely. Why does this happen? The prostate tissue is sensitive to hormonal changes, specifically the levels of dihydrotestosterone, or DHT, a byproduct of testosterone. As men age, the balance of these hormones shifts, causing the prostate cells to proliferate. It is a natural biological process, but one that our modern lifestyles often exacerbate. Identifying these symptoms early allows for lifestyle interventions that can stabilize the situation before medication or surgery becomes necessary. In the following sections, we will discuss the factors that increase your risk and the specific habits that can provide relief. We must address the who of the situation. While BPH is a natural consequence of aging, certain factors can make these symptoms more pronounced or more frequent. Genetics play an undeniable role. If your father or brothers faced significant prostate issues, your risk profile is higher. However, lifestyle choices are the variables you can control. Obesity, specifically excess fat around the midsection, is strongly linked to prostate enlargement. Adipose tissue, or body fat, is not just storage. It is an active metabolic organ that influences hormone levels in the blood. When you carry extra weight, your body's hormonal environment changes, often promoting the growth of prostate tissue. Furthermore, a sedentary lifestyle, spending long hours sitting, compresses the pelvic area and restricts healthy circulation to the prostate gland. Many men who move to more sedentary lives in retirement find their urinary symptoms worsen rapidly. But there is a counterintuitive truth here. High-intensity exercise can also be a double-edged sword if it involves specific types of cycling or activities that put constant pressure on the perineum. We will delve into the types of movement that support prostate health rather than hinder it, and why even 30 minutes of consistent, low-impact activity can change your physiological outlook. Nutrition is one of the most powerful tools you have, yet it is the one most often overlooked. Certain foods promote inflammation throughout the body, and the prostate is no exception. If you consume a high amount of red meat and processed foods, you are essentially fueling a fire within your body. Chronic inflammation is a known driver of prostate cell growth. Conversely, a diet rich in lycopene, found in cooked tomatoes, has been scientifically studied for its protective benefits on prostate tissue. Think of these foods as fuel that keeps the cellular environment stable. Omega-3 fatty acids, found in fatty fish like salmon or flax seeds, are equally critical. They work to dampen the inflammatory response that triggers prostate swelling. Many men ask, is it too late to change my diet? The answer is a definitive no. Your body is constantly turning over cells, and providing the right nutrients can change your internal chemistry within a matter of months. We are not talking about restrictive dieting, but rather the inclusion of specific, high-value nutrients that protect your prostate. It is about shifting the balance from a pro-inflammatory state to an anti-inflammatory one. Let's look at the specific dietary habits that yield the best results for men over 60. When we talk about hydration, timing is everything. It is not about drinking less, it is about drinking smarter. A significant portion of your daily fluid intake should occur before the late afternoon. Many seniors find that front-loading their water consumption allows the kidneys to process fluid during the active hours of the day. This simple shift in timing can reduce the frequency of nighttime awakenings, allowing for the deep, restorative sleep that is essential for immune function and hormonal balance. Sleep deprivation itself is a stressor that worsens prostate symptoms by increasing cortisol, which creates a negative cycle. By managing your fluid intake, you stop the cycle of exhaustion. But what about supplements? Walk into any pharmacy, and you will see dozens of bottles promising prostate health. From saw palmetto to beta-sitosterol, the market is flooded with claims. We need to look at what the science actually says. Some supplements show modest benefits for symptom relief, while others have little clinical evidence. It is crucial to distinguish between marketing and medical reality. We will explore how to approach supplements safely and why they should never replace a professional medical consultation. One of the biggest mistakes men make is the fear-based approach to screenings. There is a common anxiety that if you go to the doctor and test for prostate-specific antigen, or PSA, you are looking for trouble. This is a dangerous misconception. The PSA test is a tool for information, not a sentence. In medicine, knowledge is the primary weapon against progression. Knowing your baseline PSA level allows your doctor to monitor changes over time. A single high number is not necessarily a diagnosis of cancer, but it is a reason for further investigation. When you avoid these checkups, you are essentially flying blind. You are leaving yourself vulnerable to conditions that are highly treatable when caught early but problematic if allowed to progress. The modern medical approach is much more nuanced. It is about active surveillance and informed decision-making. You are the partner in your own healthcare, not a passive observer. In the next segment, we will discuss exactly what a consultation looks like and how to communicate your symptoms effectively to your physician to ensure you get the best possible care. Effective communication with your doctor starts with preparation. Do not wait for your doctor to ask the perfect questions. You should walk into the exam room with a clear record of your symptoms. Keep a simple log for 3 days. Note the times you urinate, the volume, and any urgency or discomfort you feel. This data is invaluable to a urologist. It transforms a vague complaint like, "I go a lot," into a concrete medical history. When you explain these patterns, your doctor can distinguish between bladder issues, prostate enlargement, or other related conditions. Remember, you are aiming for a diagnosis, not a guessing game. During the exam, ask about the IPSS score, the International Prostate Symptom Score. It is a standard questionnaire that helps quantify your symptoms and track your progress over time. If your symptoms are interfering with your daily life, be clear about that. Do not minimize your struggle out of politeness. You are there to optimize your health, and your doctor needs to know the full extent of the impact on your life to provide the right treatment plan, whether that is medication, lifestyle changes, or other therapies. Now, let's address the role of pelvic floor muscles. Yes, men have a pelvic floor, and it is a key component of bladder control. Often, as we age, these muscles weaken, contributing to the feeling of incomplete emptying or urgency. Kegel exercises are not just for women. They are a highly effective, non-invasive method for men to regain some control over their bladder. These exercises strengthen the muscles that support the bladder and urethra, helping to manage that dribbling sensation that bothers so many men. The best part? You can do them anywhere. While sitting, reading, or watching television. We will detail the proper technique for these exercises, as doing them incorrectly can be counterproductive. It is about consistency, not intensity. A few minutes a day, performed with proper form, can yield significant improvements in your urinary control. This is one of the most underutilized, yet powerful, tools in a man's health toolkit. By combining physical exercises with dietary adjustments, you are creating a comprehensive defense strategy for your prostate health. Stress management is another critical, yet often ignored, factor. Chronic stress triggers the release of adrenaline and cortisol, both of which can increase muscle tension, including in the pelvic floor. Have you noticed that when you are stressed or anxious, your urinary frequency increases? That is not in your head. That is your nervous system directly impacting your prostate and bladder area. Practicing simple breathing techniques or mindfulness can help down-regulate this stress response. It is about calming the body's internal environment. When your system is in a state of fight or flight, your organs do not function optimally. By intentionally slowing down your nervous system, you reduce the physical tension that exacerbates BPH symptoms. This is why restorative practices like gentle yoga or daily walks in nature are not just lifestyle fluff. They are essential components of a robust health strategy. We are aiming for a holistic approach that treats the whole man, not just a single gland. The connection between mental state and physical symptoms is one of the most fascinating aspects of urology, and mastering it gives you a distinct advantage in maintaining your long-term health. As we approach the conclusion of this guide, it is important to reflect on the nature of aging. Aging is a process of accumulation, of experience, wisdom, and, inevitably, physical change. The prostate is just one aspect of this journey. The key takeaway is that you are not a victim of your biology. You have the capacity to intervene, to stabilize, and to improve your quality of life at any age. The steps we have covered, tracking symptoms, adjusting hydration, choosing the right nutrients, and engaging with medical professionals, are all part of a proactive health mindset. You are building a lifestyle that supports your longevity. It is about taking the silent out of the problem and replacing it with informed, deliberate action. There is no shame in facing these issues. They are universal among men as we age. The shame lies only in ignoring them when help is readily available. You have the tools now. The next step is implementation. Start by observing your patterns, and take that first step toward a conversation with your healthcare provider. Your future self will thank you for the diligence you applied today. Thank you for joining this deep dive into prostate health. By choosing to educate yourself, you have already taken a significant step that most men never take. Remember, health is not a destination. It is a continuous process of stewardship. Keep watching for the signs your body gives you, and never hesitate to seek professional advice when those signs persist. If you found this information valuable, consider sharing it with someone who might benefit from it. Our health is interconnected, and the wisdom we share with our peers can change the trajectory of their lives, just as it can change yours. Stay proactive, stay informed, and most importantly, stay consistent with the habits that make you feel your best. We have laid the foundation, but the application is entirely in your hands. Take control of your well-being today, and look forward to the years ahead with confidence and clarity. There is much more to learn on your journey to vitality, and we will be here to provide the scientific guidance you need. Take care of yourself, and continue to prioritize the health that sustains everything you do.